Hi, and welcome to today's presentation of glibenclamide. In the next few minutes, we'll deep dive into understanding this medication, its pharmacokinetics, pharmacodynamics, physiological effects, its place in the regulatory framework, and how to provide effective counseling to patients who use it. Glibenclamide, also known by its trade name Gliberide, is a widely used medication managing type 2 diabetes mellitus. This medication falls under the class of drug known as sulfonylureas. The primary purpose is to regulate and control blood sugar levels in individuals diagnosed with type 2 diabetes. Glibenclamide operates by stimulating the beta cells in the pancreas to produce and release insulin into the bloodstream. Insulin, as you know, is a vital hormone responsible for facilitating the uptake of glucose from the blood into the body's cells where it can be used for energy. One of the remarkable aspects of glibenclamide is its ability to lower elevated blood sugar levels effectively. It's particularly useful for individuals whose blood sugar levels isn't well controlled through dietary and lifestyle modifications alone. When ingested orally, typically in the form of tablets, glibenclamide is absorbed into the bloodstream through the digestive tract, eventually reaching its target, the pancreas. Here, it triggers the release of insulin, which assists in the regulation of blood sugar levels. Importantly, glibenclamide is intended for treating type 2 diabetes, characterized by insulin resistance and insufficient insulin production by the pancreas. It effectively addresses these challenges by stimulating insulin production and improving glucose control. However, it's important to emphasize glibenclamide is not suitable for individuals with type 1 diabetes, where insulin production is severely impaired, as it primarily enhances insulin secretion. Approximately 80% of glibenclamide is typically absorbed in the upper part of the small intestine after oral administration. Its absorption can be influenced by factors such as food, with better absorption occurring when taken with meals. The primary site of glibenclamide metabolism is in the liver, where about 50% of the drug undergoes transformation, forming metabolites that may have different properties than the parent compound. The liver's enzymatic processes are essential in breaking down the drug. Glibenclamide and its metabolites are primarily eliminated through the kidneys, with roughly 50% of the drug and its metabolites excreted through this route. Renal excretion is a critical route for the removal of this medication from the body. Explore the pharmacodynamics of glibenclamide, shedding light on how this medication operates within the body to regulate blood sugar levels. Glibenclamide is known for its potent pharmacodynamic action, primarily within the pancreas. The primary process at play here is the stimulation of the beta cells in the pancreas. These specialized cells are responsible for producing insulin, a hormone critical for glucose regulation. When glibenclamide is introduced into the body, it effectively signals these beta cells to produce and release more insulin into the bloodstream. This increase in insulin production has a direct impact on blood sugar levels. Insulin acts as a key that unlocks the body's cells, allowing glucose to enter and be used for energy. In essence, glibenclamide helps normalize blood sugar levels in individuals with type 2 diabetes by increasing insulin availability and promoting the uptake of glucose by cells. However, it's important to know that glibenclamide doesn't cure diabetes, rather it helps manage the condition by assisting the body in achieving better glycemic control. The effectiveness of glibenclamide in lowering blood sugar levels makes it a valuable tool in diabetes management, but its use should always be guided by healthcare professionals to ensure safe and appropriate dosing. Glibenclamide's primary physiological effect is its ability to reduce hypoglycemia, which is high blood sugar levels, a hallmark of diabetes. Stimulating insulin production in the pancreas and enhancing the uptake of glucose by cells, glibenclamide helps lower and maintain blood sugar levels within the target range. This reduction in hypoglycemia is critical in preventing diabetes-related complications. Elevated blood sugar levels over time can lead to issues such as neuropathy, retinopathy, and cardiovascular problems. By effectively managing blood sugar levels, glibenclamide contributes to the prevention of these complications, ultimately enhancing the overall health and quality of life for individuals living with type 2 diabetes. Glibenclamide is classified under Schedule 4 of the Standard for the Uniform Scheduling of Medicines of Poisons in Australia. This designation places it in a prescription-only category, meaning that it can only be legally obtained and used with a valid prescription from a licensed healthcare provider. Prescribing or dispensing glibenclamide requires a thorough understanding of legal, clinical, and ethical considerations associated with Schedule 4 medications. An interdisciplinary healthcare team comprising pharmacists, physicians, nurses, and other healthcare professionals plays a pivotal role in ensuring the safe and effective use of this medication. This collaborative approach helps patients receive the right treatment and guidance, contributing to better outcomes in the management of type 2 diabetes. First and foremost, patients should take glibenclamide exactly as prescribed by their healthcare provider. This medication is typically administered orally in tablet form, and it can be taken with or without food. However, specific dosing instructions may vary based on individual medical needs. It's important for the patient to stick to consistent dosing times and not to miss doses to maintain stable blood sugar levels. It's also crucial to discuss the potential side effects, which may include hypoglycemia, weight gain, and gastrointestinal symptoms such as nausea. Educate patients on recognizing the signs of hypoglycemia, including shakiness, sweating, and dizziness. Encourage them to be prepared with fast-acting carbohydrates like glucose tablets or fruit juice to raise their blood sugar if needed. It's also important for the user to report any unusual or severe side effects promptly to their healthcare provider. After starting this medication, regular follow-up appointments with the healthcare provider are essential. These visits help monitor the medication's effectiveness and assess for any adverse effects. Remind patients that glibenclamide is just one component of their diabetes management plan. A balanced diet, regular physical activity, and the regular blood sugar monitoring play crucial roles in achieving optimal control. Now let's test your knowledge with a few simple questions to ensure that you've absorbed the information we've covered in this presentation.